Hello everyone, thank you so much for being part of Joy Asonye Live this beautiful Thursday. I've been looking forward to this, as the topic we are delving to this evening is very interesting. It's something that really it affects everyone in the society, and that is Nigeria's occupational safety. Where are we on that? Recently, the subject of occupational health in Nigeria has gained more daily audiences with both employees and employers. Can you ask for compensation when you are hurt in the workplace? What should you do to prevent injuries at all? Well, the study of occupational health or occupational safety is broad, as it covers several, mental, physical, social well-being of people at work, including issues of stress prevention. I know a lot of you who are watching us right now would be smiling. Are we in the West, or this is Nigeria, where such things are not put into consideration? My guest, he is the safety minister. The safety minister, who is my guest, Dr. Emmanuel Uwalaka, the regional administrator, Occupational Safety and Health Association, that's OSHAssociation, is right here to give us, to put everything into perspective. It's so wonderful to have you join us.
Thank you so much. I'm very glad being here today.
Yes.
Thank you.
Having said that, we'll go for a short break, and then when we return, we'll delve into the issue at hand. Stay with us. This is still Joy Asonye Live. Welcome back from that short break. Nigeria's occupational safety policy, that's what we're discussing. And Dr. Emmanuel Uwalaka, aka the safety minister, who is also the regional administrator of Occupational Safety and Health Association, is right here with us. Let's start from the basics, Doctor Engineer, really. I'm not sure I wouldn't interchange it.
I see.
So where would you say the awareness is amongst Nigerians when it comes to occupational safety, the role of employer and employee?
Yeah, thank you so much. I think from the areas of our discussion today, looking at Nigerians' occupational safety policy, and looking at where we are today in Nigeria in terms of awareness, is really quite interesting to know that the issues of health and safety is improving in the country today, because, you know, before now, Africa are very far from the realities when it comes to health and safety. There are so many issues and so many non-conformities that have been ravaging different industries, which borders more on health and safety matters. And because these things have been happening over time because of lack of knowledge, lack of the skills, lack of information, you know. But currently, as I speak, Nigeria is beginning to appreciate the importance of safety knowledge and skills in the workplace. They are beginning to look into putting the technical framework, look into putting the technical measures in place to ensure Nigerians' workforce are being safe at work, and also have a better well-being at work. So there is, I would say randomly or maybe collectively, there is a kind of improvement currently, because recently the head of service of the Federation have really commenced a very proactive move, making sure that all the public sector, all the ANDS in the country, Nigeria, is beginning to put measures in place. And not just that, appointing appropriate officers to be able to manage the welfare of their workers, and also look into recognizing various hazards and risks associated with their work environment. So it's a good development, because when it comes to safety, the first thing is identification of the hazard.
Right.
You need to really identify what you are dealing with. That gives you another professional steps to be able to know the measure you have to put in place to ensure safety, to ensure zero fatalities, zero injuries, and also zero death at workplaces.
Okay, now with so much necessary to do, you said the first step is to identify, but when you look at the Nigerian work setting, let's talk about the occupational hazards now. You would agree with me that very little attention is paid into safety of the people. Do we have compensations coming in cases of injury or even death when people are exposed to hazards in the workplaces?
In areas of compensation, is something that is very, very critical, and is also something that have to do with having necessary laws in place. But currently, there are so many policies in place to safeguard the lives of Nigerian workers, to safeguard the lives of employees in various industries and also in various workplaces. But the point of compensation, I wouldn't say there is a very proactive system or maybe policy in place, because we are still yet to mature to the realities, which is having the OSH bill still in the National Assembly to be passed, which will give birth to a strong instrument that will help to, gain necessary compensation where a worker is dead, or where a worker is found dead, or where a fatal injuries are caused, things of that nature. So there is no yet strong instrument to address that, but there is a development, and there is a process still in motion, to get that things, especially with this new government, I believe those are going to be addressed. But the policies are in place to ensure that workers, employees do their own part, because there are employees' parts and there are employers' parts.
Exactly.
So everybody have roles to play when it comes to safety. Safety is not only solely made for employers. Even when the employers have provided resources, have provided trainings and information, the compliance and also the doing have to be left with employees to comply for you to be able to have a safer workplace. So, and also in my own view, when you're talking of compensation, if you are to live a very restless life, or maybe taking some unmeasured movements that have granted or maybe have bring some kind of injuries, fatalities, or death, I wouldn't say that looking for compensation would be the best idea for anybody to start thinking about, because when it comes to safety, some of the errors or some of the fatalities, you may not be out of it. So it's the living that looks for benefits.
Exactly.
So, and in some cases where you are trying to say, okay, you have to move into this field, or you have to do this, have to do that, without considering your safety first and making sure that you are secured and you follow due process and safety protocols and safety measures for every assigned task, then you are jeopardizing the whole system. And if any accident should happen and you are not out of it, in some cases, even your family can claim the compensation.
Exactly.
So, as a safety professional and as an expert, we always advocate, we always advise, like my institution do, Occupational Safety and Health Association. One of our major targets is to carry out this awareness to all Nigerians. Let them understand that safety cannot be overemphasized when it comes to day-to-day activities, when it comes to decision making. Because safety has to do with decision making. Once wrong steps you take can land you into a very serious fatality. So moving with the right senses of making sure you fight towards prevention is the right idea for anybody. Do you understand?
Yeah.
Because when you are just trying to do your things anyhow, and you now have to have 1 or 2 incidents, and that is very critical. Compensation shouldn't be, what any individual at all should be thinking about. You should be thinking prevention, 0 incident.
Exactly.
Safety first. When we say safety first in the Western world, is a reality.
It is.
They are not just trying to write slogans or try to just, put it on a paper. They are trying to practice it. Every individual at the workplace practice with best practices, safety best practices, making sure they are following the right steps, the right equipment, with the right people working, making sure that at the end of the day, no fatality
at all.
The workplace. Yes.
Okay, let's move a little away from occupational hazards. Recently, the Federal Road Safety Commission recently disclosed that 1,349 people were killed in road accidents between January 2023 and April 12th, 2023.
Exactly.
That is people who were killed. I'm not talking about people who were injured, people who were just involved. People who were killed was as much as 1,349 within January and April. So have we done enough in Nigeria cascading this OSH information down to the auto sector?
Okay, I'm a bit laughing because you know that we are not yet very accurate with information, with data.
With data.
Exactly. So when you
these
say
are just the reported cases.
Exactly.
And it's still very alarming.
And I can assure you that non-reported cases is higher than the reported cases.
Wow.
Exactly. Because every day you see so many incidents happening, so many crashes happening, so many accidents, or whether it's tricycles, the bike people, the motorists, and accidents are happening every moment. So when you check it by each state, by each local government, by each cities, you find out that the reality is very clear, because the number of measures in place to be able to capture incidents on our roads is very minimal, and we cannot say that we are going to work with such data, because yes, that is reported cases, as you said, but more far than that is happening. Even in some cases I have seen in the city of Abuja, where you see very critical fatal accident happening at 11 p.m.
Yeah.
12
p.m. There was no traffic.
Nobody to even report to, because from there you move to hospitals, and from hospital nobody gets to know what really happened. The government don't get to know what really happened. In the developed countries, there is a system in place to report incidents. If in the cities anything should happen, first there is a database to be able to, all hospitals established in the country have a central database to report such cases, and for you to enter the government database to give you accurate information. That is the way it's done in the developed countries. What
is wrong with our data? Not to digress, but it's really important to address this. How can we harmonize our data? How can we get it right? I keep reminding everybody that when it comes to the private sector, they seem to know how to get data. But whenever it comes to government, what would it take for the police, the Federal Road Safety Commission, hospitals, to have a harmonized data as to who was involved in what, and how terrible or fatal was this? What was the investigation eventually? So that I could just say that this person had an accident some time ago. In cases where, like OSH, maybe your policy would be robust if you have this data. But why is it so difficult in Nigeria?
Because it's very difficult, because there is no yet very proactive policies, and also drivers of those policies making sure that it's being implemented. Because sometimes we have very fantastic policies, but implementation is a problem. So until we have leaders and people in power who can be able to, in relevant authorities, or whether in the healthcare, in the ministries and whatever, to be able to ensure that the private sectors are compliant, that the government facilities are compliant, then we can be able to have a unified data. And you can also agree with me that we're in the country where anybody can set up hospitals at any place without with necessary approval, but And anything can happen there. Accident can happen somewhere. They move the person over there, and at the end of the day, there is no way to capture what really happened and for government to know about it. So that is it on the area of data matter. But we hope and believe that the future will be able to address some of these things. So the issues of the rate of accident happening is very high, you see, because people, imagine this rainy season now, you see people driving anyhow on Fridays, Saturdays in the cities of Abuja, likewise many other cities.
Yes, it just seems like every after the weekend, there are cases of accidents.
Exactly, because the roads are free. In the night, the roads are free. People are speeding and all that. So I have seen so many fatal accidents, and none of such, I believe so well, that government will not get to know about it.
Right.
And nobody will even get to know about it. So how will you report such cases? There is no way.
So how do we get better? Because if those cases are not reported, how can I then say, okay, we need a speed bump here. Maybe we need something done with our tires here, or just to make sure that we fix components of the society.
Some of those problems will definitely be addressed if the proper risk assessment is carried out.
The risk assessment.
Yes.
We keep talking about risk assessment.
Risk assessment need to be carried out to be able to identify where you need to put some speed bumps and where you need to place some of these facilities, and also, look at our road infrastructure, because we don't also have enough road infrastructure to address some of these things the way it is in the Western world. So, but I believe as the advocacy goes, because the main point here is the advocacy. If we get to push this advocacy and Nigerians get to know more about issues of safety, their own safety, and know that they need to minimize their speed, know that they have to wear their seatbelt in case if anything happens. Why the seatbelt is there is in case of emergency, in case of fatality, in case of accident. So it's not that that's why people say, it's not going to happen to me, it's not my portion, it's not that. We know that it's not anybody's portion, but you have to do the right thing, in case of anything happening. So these are what Nigerians need to get to know, that safety is a personal deal. It's a personal decision.
Right.
It's personal. It's you. It's your life. If you do it right, you save your life. But when you don't do it right, you lose it.
We keep talking about safety, and something came to mind. Recently, there was a video. Somebody wrote an article having done a small investigation as to how people inflict injuries on themselves so that they can get compensations, not just from the insurance companies now, from the employees. But you are a safety minister. The safety minister who I don't know who's did the president have to submit your name, or a self-acclaimed safety minister. As the safety minister, I'm sure you've come across all facets and all the kind of faces that it often takes. Do you see that? And when you do see that, what's the way out of this when employees inflict injuries just to get compensation or benefit of some sort?
Yes, I got your point. And you also have to understand, currently we have an agency of government that is in charge of compensation when it comes to accident, which is NSITF. They are charged with that responsibility. So it's within their jurisdiction to be able to investigate accident. But before you can claim anything from that agency, from my own understanding, you need to register with them. Your company or your organization must register with NSITF, and you must also have to pay your dues, or your I don't know how many percent every employee, certain percent you have to pay, based on the number of employees you have. So when there is any fatality or any issue, I think the company or the employees can report to be able to claim a certain, based on the nature of the accident or incident and based on the investigation. Because you can't just run to such an agency and say that this happened, that happened, you want to claim 1 million.
Right.
So there have to be a whole lot of investigation to find out what happened. In an organization, they need to know what happened for you to have this accident.
Right.
They have to investigate what have been put in place. What have your organization put in place to prevent this kind of accident? They need to know where the fault is coming from. Is it coming from the employees? The gap, is it coming from employees, or whether it's coming from employee? So they must have to know. And in some cases, for some organizations that have a little bit knowledge of safety compliance, they do everything possible, that they train their employees, they certify their employees. So if you are found in any form of accident, or maybe you're involved in any kind of accident, and the employee will tell the world or will tell the agency, look, this fellow, we train him on defensive driving, and we have trained him, and this is certificate, and for him to have involved in this accident is his own negligence. So it becomes more serious, because at that point, the company or the firm will want to withdraw from any further compensation or any further issue that have to, drag them into unnecessary charges and things of that nature. Now, in the case where employees don't provide necessary resources of safety information and order to make sure that you are safeguarded in such a critical task, then the company is also liable. They have to pay so many kind of compensation. They have to handle the hospital bills. They have to, pay a lot of fine where necessary. But
this is just so that they are more safety conscious.
Exactly.
These are just fines that is supposed to keep them on the edge.
And the issue with some of these fines is also that in the country like Nigeria, I have seen some fine where they tell you, if this happen, you pay 500 naira, and I would just burst
500 naira.
Exactly, and I would just burst into laugh, because I wonder how what 500 naira or what 1,000 or 5,000 can do in cases of such an issue. So I have found such before now. Now,
you said before now, what is the state
currently,
of what currently has it been reviewed?
No, currently, by the time we have the OSB pass into law, some of these things is going to be reviewed. Because we are still operating with the old policies, working with the Factory Act, and with so many other regulations within the oil and gas, or maybe mining, and many of those policies and rules and standards made by those agencies. But I believe that time will come, we'll be able to have more serious laws into it. Like the way it is in the UK, the way it is in America. You see where government is charging a company over 13,000 pounds, charging over 500,000 pounds. These are serious money, so that you'll be able to sit up and you'll be able to do the needful to the people who have lost their arms, which cannot be replaced.
Exactly.
Who have lost their eyes, which cannot be replaced. So these are critical issues that need to be dealt with, actually.
Right. I would like us to go to the schools, and sometimes we find, I know not on this platform, you and I had spoken about how schools have not done enough in not baby proofing now, but just adhering to safety standards that would ensure that pupils are safe. And for the internet now, the internet has made everybody connected, and so we get to hear these cases firsthand. And some of them, it's outright complacency from these schools who could have done better to protect the students or pupils in those schools. So what would you say the schools should do, and where would you say government should push more in terms of ensuring that young people, students, pupils are safer in school environments?
Yes, to address this issue of schools, government, especially the Minister of Education, at a point have to start putting fence rails and so many things because of issue of banditries and kidnapping and all that. That is just by the side. Now, coming straight to the issues of safety of the pupils and the students is more critical. We have seen cases where primary schools, pupils, and maybe injuries happening within the school environment. Even within their PlayStation. The purpose, the issue why some of these incidents happens is because of lack of proper professional risk assessment of the environment. To be able to identify the hazard zones, the risk zones, and know how to manage the hazards, because you cannot eliminate hazards actually outrightly, but you can control it. You can control it. So in some cases where you see schools don't have this knowledge, They don't understand. So many times we have programs and events. We invite so many of these schools. They will tell you what are they coming there to do.
They don't even understand the reasons why they should be updated with safety
information, because they feel that the school environment is so safe and is so free from equipment, from any kind of technical issues. But there are a whole lot of safety issues within the school environments. Talking about where you put pupils, where you I have been to some schools where you see within the age of 5 years, 3 years, you are seeing sockets at the reach of the hands of those little children. And when you look at it and look at the number of teachers in such a class, maybe one person. How can one person control over 30 pupils in a class? So you may not know what somebody is doing out there or what somebody is doing over there. So, and also even their playground, to be able to carry out risk assessment, to know what is the appropriate kind of equipment, the kind of environment made for this kind of people. You know, these things are not in place because there have not been policies in place to address that. In the Western world, you know, you see some of these things even at a level of making sure that the classrooms, the number of people that, based on the number of teachers in such class, need to be considered.
Exactly. Because
part of safety issues. You are talking of people who don't have much knowledge. Only they are fighting, they can take pen and just chuck it to somebody's eyes.
That's if they do not have enough
hands to be able to care and to be able to watch over them. So these are part of safety.
Do parents, I mean, we are still getting to homes. We're just taking it in bits. But do you think parents are aware of these things when they pick schools for their wards?
You know, that is actually a little bit also far from the truth, because you see some of these incidents happen in schools. You know, teachers will just tell you, your child got involved in this, he got involved, they have taken him to hospital, they are taking her to hospital, sorry. And it will just go that way.
And trust Nigerians, we live and for God.
But it can't happen in the developed country, because that school will pay through their nose.
I am leaving my child in your safety, and
so
I expect
anything happens, even just an inch crash, not just even serious, just a crash, not from hope, from this school, you pay with your nose. So that is because the institutions involved, the agencies of governments involved have put policies in place to say, in this classroom, this is the number of people that must be in such a classroom. This is the qualification of the kind of, the teacher that need to oversee this class of people, which requires more care, more detail to ensure their safety. You see it? So these are issues. Now, you come to issues of events within the school, even inter-house sports and all that. They don't consider safety. Safeties are not put in place. So,
Dr. Uwalaka, it's time to go for a break. I mean, I'm having such a good time that we've gone half hour into the program, but we'll go for a short break, take a breather, and return to discuss more. Remember, we're talking about occupational safety and health. How can you ensure that you are keeping your environment safe? We'll be right back after this short break. Welcome back from that short break. We have been discussing Nigeria's occupational safety and how aware we are. Indeed, we had also mentioned how important, especially in workplaces, the mental, physical and social well-being of employees. How much do we put in place to ensure that the mental well-being of employees is taken into cognizance? Dr. Emmanuel Uwalaka, aka Safety Minister. I often call him self-acclaimed Safety Minister because we're hearing names sent to the Senate. Yeah. I didn't see yours as the Safety Minister. So you are self-acclaimed Safety Minister. The Safety Minister,
the Gospel of Safety.
Yes, the Gospel of Safety. So exactly. The Safety Minister is right here with us on Joy Asonye Live today. He's the Regional Administrator at Occupational Safety and Health Association. Let's go to the mental well-being of individuals. We are Nigerians. I can imagine that if you are not in Nigeria, you can actually go there to say, you know what, the work environment is toxic, and so I want compensation for that. Yeah. But in Nigeria, who are you going to tell? Work environment is what? When you're you take it in prayers. You take it in prayers. But are we getting there at all?
The issue of mental health, you know, the state of the country now when it comes to mental health is very high.
All man want job first.
Yeah. So the risk is high, you know, when you look at what Nigerians are passing currently, and look at, you know, I've seen a case recently where somebody told me, he said that, the vehicle just carried me past my house. I was not aware. I said, so you don't know where the vehicle.
That person's work situation should be reviewed or checked.
Exactly. So you find out that everybody is really passing through one mental health issue or not, you know, and coupled with the stress and so many, especially now, looking at the petroleum heat and all that, a lot of people are not even driving. A lot of people are just trying to manage their life based on the budget. So it's quite challenging. But my kind advice to Nigerians at this point is to review their day-to-day activities, review their plans, review their projects at hand, so that you don't actually get yourself into undue stress and mental issues that will cost you more. Because in a case where you are managing some certain amount of money and now you are going to double it, is a challenge.
Exactly.
And there is no resources to be able to manage
that's
exactly.
more you were already managing.
So it is a problem. So, but for the sake of safety, it's advisable that as Nigerians, looking at what we're passing through now, as some people already do, I met a friend sometime, he told me he's already parked his car because he can't be fueling a car for 50,000 naira within 2 weeks. So how much is the salary? So you can't be talking of the whole month, you know. So these are challenges. So you need to review some certain things. You need to make new plans, you know, and see how it goes to help yourself. Because if you should have any issue, or maybe at the end of the day, it generates to some illness that is going to cost you thousands of naira and hundreds of thousands of millions or all that, you find out that you are going to be in the most critical situation. Because that money is not going to be out. I traveled sometime to the east. I was seeing how people are really suffering actually, but I have to also advise new way of life. New way of life. Because if you continue to complain and you continue to put yourself into some undue pressures, you find out that you may just die without even the president or whoever, or your senator or whoever you are claiming that is killing you getting to know that you have gone.
Exactly. They couldn't be bothered because, I mean, they wouldn't even know exactly.
Who knows? Nobody. So, is your own life, is your own safety. Or say, your life, your safety. You get. So, in some cases, you cut your coat according to your what? Size. Don't try to impress anybody. These are mental safety issues.
Okay.
You don't try to impress anybody. You don't try to go. I have seen people moving into borrowing money to settle a problem, or borrowing money to start a business. You know, it's quite unfortunate we're in the kind of continent where people have to do much of business with money and all that. You know, in the Western world, a lot of intellectual businesses are there where you can do without much money, and you are generating, you know, and you are generating fund. You know, But in this part of the world, everybody need money to start something. Because that is the one they have the capacity for. And it's quite not interesting that we're in this condition. But we have to now plan our lives, plan our movement. You know, if you can work from home, fine, and deliver the same result, good. Then if you can cut your movement, you know, you have a friend that is going for wedding and he's telling you everybody come for the wedding. It's not compulsory that you must go for the wedding. The little money you have, you can send it across. He or she will appreciate it. Than traveling and putting yourself in a very undue stress, you know, more critical and all that. For example, you're also traveling, or maybe you need to travel and there is need to go with your vehicle, and you find out that this your vehicle is not adequately in order to move you from Abuja to Kano,
right, or
from Abuja to Anambra State. So, for your own safety, you just have to take public transport and manage yourself from stress of the car breaking down on the way. You know, putting yourself on some unnecessary risk. And at the end of the day, you know, if something should happen, or maybe the tire just flew, or maybe the tire just burst, or maybe it tumbles and all that, more critical problem will result because of negligence of safety.
And very often it can get very fatal.
Very, very. So you find out that these accidents are preventable accidents. Many accidents you see in our roads today are, most of them are preventable accidents. You see somebody, instead of you to do the needful, park the vehicle, or maybe try to fix the vehicle if you have the money. If you don't have the money and the travel is very important, you have to use public transport. It's more safer for you. Then, at the end of the day, you go peacefully and return back peacefully. Than using your own vehicle, you don't do the needful, you just gather some people and call your pastor, let's pray. Okay. You pray and pray and pray, something still happen.
Right, let's go to the OSHAssociation. I know that they've been doing several advocacy summits and all of that. I know recently you inducted some people as fellows. I think I saw that. I think I saw that on TV. But just give us an idea as to what you do really. Are we getting to that point where we'll see OSH personnel go to organizations and ensure their safety, and maybe even have a safety receipt to show that for 4 months or 5 months, or this organization is safe, they rate them in A's, B's and C's and all of that? Are we there yet?
Yes, as an institution, Occupational Safety and Health Association, UK Nigerian Regional Office, we have been doing our best actually, because the best answer to some of these problems we are facing is awareness. More awareness, more prevention. More awareness, more prevention. And that is what we are doing on day-to-day basis. That is what our institution is doing on weekly basis. Across various states, across various industries, and across various cities. You know, creating the awareness and getting people on board, because we need more safety advocates. We need more safety advocates, safety ambassadors, who can pass this message across to others who are not knowledgeable with it, who can also give directions and give suggestions and advise the organization on the right thing to be done in order to achieve zero fatalities or zero incidents within the organization. That is the purpose of the membership that our institution is doing.
Right.
And on the issues of working with organizations, we are actually doing that.
You have the mandate. I mean, can you walk into any organization to say we want to review or...
No, we are not government, so we cannot enforce anything.
Right.
We can only help work with you cordially to set up policies, to conduct training, pass the informations, and give certification to show that we have done something like this. Which authorities can come, you show and say, yes, you have done something of this nature. Okay, that is good, and you are trained by this professional body. We are not a company, we're a professional body, just like churches. So whether people come, people don't come, we have to still do the advocacy. We have to do the awareness. We have done so many trainings and free workshops, virtual, physical, for both government agencies, both private organizations, both during the World Safety Day, both during various occasions. We keep doing that till tomorrow. We keep doing that. Because even in cases where such organizations don't have money to train their employees, we still offer free workshops.
Oh, really?
Yes, we still offer free workshops.
I can apply for...
Of course,
wow.
because we value lives. We are not doing business. We value lives. Lives first. Lives first. Just like what the churches and the mosques are doing. They are taking it spiritual. They have to cancel.
Taking it safety-wise.
No, physically wise, safety is the answer.
Right.
He said, so we do everything needful to make sure that we pass the message to millions of Nigerians. Because as I speak to you now, we don't have an agency handling this kind of cases and have so many officers like police to go and police you and say, what do you want to do today? And how do you want to do it? You have to explain. Because that is the safety. Safety have to do with decision. If you take the wrong decision of going home this evening, you may get into trouble.
Right.
But if you take the right decision, you go home safely. That is safety. That is in every work environment, in every operation, we have what we call self-operating procedures. The subs for every what for you for technician as a mechanic is different procedure for somebody who is also doing a welding. Different procedures. So you have to understand the safety procedures associated with your work environment. Even you are sitting in the office using your computer, you have to understand that your safety can generate a lot of ergonomic hazards which have to do with the sitting position, the kind of chair you're sitting, your sitting position, how long you are sitting on that desk, and how, these are ergonomic issues that have to do with the workstation. So you must understand. People don't have information. People don't really understand some of these things we are talking about. So the only thing that we answer is awareness, advocacy. That is why we are working in every organization. We want to make sure we pass the message. We want to make sure we pass the message, and I'm very happy that our institution is working closely with so many NDS and so many organizations to be able to do this. And not only that, in 2020, the Honorable Minister of Health, the former Honorable Minister of Health, and so many other former ministers, they were in our conference to launch National Safety Advocacy Project. And that project have really turned out to be a very commendable project so far as health and safety is concerned in Nigeria. Because out of that project, government have begun to recognize safety proactively. Government have begun to put measures into place. Companies have begun to support.
Before we go to companies, I would like us to explore this. Government are beginning to provide.
Government have beginning to do the needful.
In what instance?
Areas of even appreciating that safety is needful.
That's not sufficient for somebody like me.
That's not sufficient, but that they are not telling you. I have seen so many senior officers, health and safety. No, senior officer, they will tell you health and safety is not important here. We are not oil companies. We are not construction companies. What do you need? What are you coming to tell us? That is anything happening to us in our office? We have AC, we have this, we have that. So we don't have problem. So they are speaking out of knowledge. So that is why I'm telling you that even appreciating that they need to put safety in place, measures in place, awareness in place, because we are talking awareness. We are talking of facilities. In government establishment, for example, I've seen so many ministries, they don't have toilets. People have to, find a way to ease themselves, visitors down. When a worker is stressed of having a conducive and a selfless, a hygienic place to, as a restroom, as a toilet, what happens to visitors? Visit the facility.
Very often they would also find their way. They would also find their way. I mean, there's no other way. They will go the way of and this is a country that is paying lip service to the fact that we should end open defecation. When I hear that, I just laugh. We're not there yet.
The solution to it is to get this mobile toilets, build more mobile toilets, put it at different intervals for public, for pedestrians, for, that is the way it is. And that's the way it should be if we want to really bring solution. So these are issues of welfare, issues of well-being, is a problem. So these are what I feel that when it comes to mental health, when it comes to hygiene, when it comes to wellness, need to really put into place.
Right. But it's quite commendable, I must say, what you do, and especially when you meet somebody who is in the humanitarian space, so to speak.
We are more or less like humanitarians. You know, nobody is paying us for. We are just independent. We are not dependent on any government. We have to seek for donors. We have to seek for sponsorship. We have to seek for support. You know, to drive the advocacy of saving lives, and that is what we specialize.
So let's go to this occupational safety and health bill that's being passed. What do you think were the setbacks with the 9th Assembly and previous assemblies?
Yes, when it comes to the delays, and it have been there over years, you know, and I will say the problem with it is also the issues of understanding the importance. You know, when a father don't understand the importance of providing the right tools, or providing a particular need for a child, you find out that child will keep crying till Jesus come. So that is the situation here. So we have to get to the level where our leaders need to know that the issues of occupational safety and health and environment is critical, is important. It can increase the economic, social well-being of the country. It can increase and also improve our GPD. There are so many issues happening, so many losses, so many disasters that are claiming billions of naira of the country. And some of these things could have been prevented from happening in terms of market fires, in terms of so many fatalities, in terms of erosions. You know, I've seen so many erosions that happens, you know, critically. Even before you get to that point of critical, exactly, they should have provided a preventive measures, or maybe arrest that situation with minimal cost than allowing to get to a level of consuming much and putting everybody into high jump. So these are issues of safety. You know, they have not really understood this importance, you know, but I believe with this 10th Assembly, with the way we are going, our last event in London, last 3 months, we have some senators who join us in that trip. They were able to
senators that have returned to the 10th Assembly?
They have returned to 10th Assembly,
right,
and they were able to see the importance. They were able to listen to these lectures, and I believe that working with some of them closely, they will be able to address and also do the needful that, so that this 10th Assembly do the needful to pass the bill and also bring it into
not just do the needful. What is OSHAssociation doing to push
what we
more?
Can do is to push more to let them know,
right? You
know, for them to understand the economic value, you know, developmental value, because even is affecting investors too. I don't think any investor will want to bring in billions of dollars and millions of pounds into a country that he or they cannot be assured of the sustainability of their investment. It's a problem. So safety has to do with sustainability. It has to do with sustainability. It has to do with quality. So if those policies are not very proactive, some serious investors will not want to get into the play, because they don't want to get into issues that have to damage their reputation they have built over years because of one investment or because of one project they are doing. Even some of our major projects, we just finished a project with an event recently which have to do with skills.
Okay.
Health and safety is part of skills.
Of course.
And in some serious organizations, when you don't have these skills certified with proof that you have been trained, have this knowledge of health and safety, you cannot be employed into such an organization. You cannot be involved in such a project. That is what's happening in, I saw it in the news, I don't know if you saw it. The Dangote refinery, over 11,000 workforce was imported from India.
Yes, I saw that too.
Fantastic. So go and seek or go and look closely. You find out that part of their requirements or part of why they did such is because most of the Nigerians, or a lot of Nigerian engineers, don't have the safety certification to show that they can deliver their jobs safely.
Wow.
And some of these multinationals don't want to gamble into such high risk of recruiting or bringing engineers or bringing technicians or people who don't have the skills to deliver their jobs safely, and they just employ them because they want to obey the local content
laws.
And at the end of the day, they enter into serious international litigation, international issue, reputational issues. So they have to bring in their own people that they have trained, that are engineers, that also have the required health and safety certification to do that job safely.
But that's not a good excuse. I mean, if you are very serious about obeying local content laws, you should do your bit in trying to get these people certified and trained.
Sure, that is what some serious agencies of government
are doing. That's in the moral side. That's in the moral side.
Yeah, right. Yeah, they are trying to do that now, and that is the area we are also pushing, because we also handle the issues of trainings and certification, which as an institution, we are also working closely with international team and also some local institutions to make sure we put this into curriculums, into universities, polytechnics, so that as they are graduating out, they are having a separate designated certification to show that they can deliver their job safely. They can do as a public health, as a nursing, as a civil engineer, as a petroleum engineer.
Above all, safely.
Yeah, they can do their job safely. So these are the issues that have to do with labor, safety labors and things of that nature.
Dr. Emmanuel Uwalaka, that's the Safety Minister.
Thank you.
I must thank you for the work that you do and the passion you speak about what you do. It's very electrifying. But we have come to the end of the program, as we have time is no longer our friend. But I have learned so much from having you be part of the program.
Thank you.
This is where we draw the curtains on Joy Asonye Live. We've been discussing with Dr. Emmanuel Uwalaka, aka the Safety Minister. He's the Regional Administrator of the Occupational Safety and Health Association. Again, I thank you.
Thank you. Thank you.
Okay, do have a wonderful evening and enjoy the weekend as it approaches.